I'd like you to imagine the horrible circumstance when you take a family member, a daughter, a son, a wife, a parent, to a hospital that you have confidence in, having a major medical problem, needing a specialist physician to come to the bedside, and you discover on arrival that that doesn't happen. And in that circumstance, when you most need the help of an excellent physician, that help is absent, and it changes your world. The outcome of your family member is worse. It has an economic impact and a personal impact, and it destroys families. And that happens every day, thousands of times every month across the United States. I'm Joe Peterson. My company is Specialists on Call, and we address this problem for hospitals today in 12 states by delivering thousands of emergency specialist consults at a distance using technology. We tell a story about a family member arriving in the emergency department with a horrible medical problem, a 29-year-old woman just given birth having a major stroke who, in our absence, would have left that hospital paralyzed and unable to speak. But because we got a specialist to her bedside, she left that hospital with no symptoms 3 days later. And that happened because we took an excellent quality physician with the background to match our care to the urgency of her diagnosis, and we moved that physician to her bedside using technology. In doing so, we relieved the local doctor of having to deliver a kind of on-call care that he or she probably doesn't want to do. We relieved the hospital of costs associated with that on-call care. We improved their liability profile just as we improved the patient's outcome. This problem, the lack of specialty physicians available for on-call, is happening every day in all hospitals, large hospitals, small ones, urban, suburban, all states, all specialties in medicine, and it's only going to worsen. And it's happening because on-call as a responsibility for local physicians is tremendously undesirable. You've probably asked why no solution like this has existed in the past, and that's exactly what we did when we started Specialists on Call. And what we discovered is that while the equipment and the technology to move physicians to the bedside has been around for more than a decade, equipment alone is not the problem. Instead, we took existing open platform technology and integrated that into a business model that addresses multiple of the customers in the healthcare delivery chain. Because unless you address all the customers, that very resistant to change healthcare system won't change. Here's how it works. Specialists on Call have a core of university or ex-university physicians who practice best in specialty care. Today in neurology. They work for Specialists on Call, and when they're working for Specialists on Call, they are doing consults by video conference and other data link to hospitals in 12 states in the United States. They're treating thousands of patients every year, resulting in stories just like this one. In 2008, we told stories like this 3,000 times. In 2009, we told those stories 7,000 times, and in 2010, more than 12,000 times, we're going to tell a story about what happens that's all good when you bring a specialist to the bedside of a patient that needs it. In summary, today, Specialists on Call focuses on neurological emergencies, where grants to purchase equipment have not delivered patient care. We now are delivering thousands of cases of care in 12 states to 82, shortly 100 hospitals, and we're growing every week. When we're doing this, we're lowering dramatically, by more than 50%, the hospital's cost for delivering on-call services, while we improve the care of these most critically ill patients. And we're doing so with a level of practice consistency almost unprecedented in medicine. We're also doing so in synergy with local doctors. We don't affect their practice or their economics, and we in fact relieve them of a responsibility they don't want. And by successfully addressing the priorities of all these members of the healthcare delivery chain, we're disrupting one of the worst aspects of medicine, and that is the delay for best practices moving from universities into the community where 88% of medicine is practiced. So here's our future. Based on our success in neurology and with our hospital clients today, we're expanding the Specialists on Call model to address other medical specialties in new hospitals in additional states. And by doing so, we expect to be able to grow the number of times we can tell the Specialists on Call story more than 100% per year indefinitely.